Well, look, ISMP is one of the most courageous examples of leadership and improvement in healthcare in our time. 20 or more years ago, before anyone was thinking about injuries to patients and safer care as an imperative, ISMP was breaking new ground and doing it at a time when it wasn't popular to do that. You think about the obstacles ISMP faced, the barriers, waking up enormous industries, the pharmaceutical industry, the hospitals, the healthcare delivery world, physicians. We didn't want care to be unsafe, but we didn't know it was, and it took someone courageous to turn the lights on.
Influence. Certainly that's a big characteristic of ISMP. It's a unique organization. It's the only organization of its stature that is concentrating on the problem of medication errors, and it's gained a lot of respect for the good work that it's done. Others want to be a part of their work, to network with them. And when ISMP speaks, others listen, and they take heed of the advice that ISMP is giving.
I think they have a passion for their work. It shows in what they do on a daily basis. The practitioners view them as the standard. If ISMP publishes something, it is taken very seriously. You see it not only in the institution, but you see it in the national press as well.
ISMP has made a dramatic and far-reaching impact, and really around how medication errors are regarded. And that began with establishing the National Error Reporting Program.
ISMP began as a maverick enterprise. It was an outlier. It was, very unusual, very courageous. As healthcare woke up, thanks in part to ISMP, woke up to the problems of patient safety, its work became more and more central. And so nowadays, I think it would be very hard to say you were deeply involved in the pursuit of patient safety, especially around medications, without drawing upon and working with ISMP and its many, many colleagues.
And ISMP really opened the door to showing that medication errors are multidisciplinary, multifactorial, often the result not of one individual acting alone, but the result of complex failures in a very complex medication use process. And that it's usually a lack of knowledge, mental lapses, system failures that have caused that medication error. And they helped us understand how to do an analysis of the system, including technology, while maintaining that individual accountability.
Well, the future relates very strongly, of course, to just trends in drug development, pharmaceutical development, medicines development. Medicines will continue to be very complex. There's pressure to get new innovations on the market more quickly, which means that in the clinical trials we don't always know all of the effects and side effects and potential adverse reactions from medications. They get discovered once a medicine is used more widely by patients. So we need a group like ISMP to keep an eye on everything, to analyze new situations that may develop, and to put the best advice out there on how to protect patients, not only getting the best use from our medical innovations, but also preventing harm to patients.
The healthcare industry is getting more complicated. New drugs are being approved, what they call the fast track, often unlimited data. And so I feel that ISMP, having the relationship with the pharmaceutical industry as this data continues to come at a rapid rate, can certainly help as they stay ahead of some of that. I feel with the sites of care that are changing, where now patients may get limited care in an inpatient unit, more care in a clinic, and in the future maybe more care at alternate sites such as the home. ISMP will be critical to ensure that we have safe medication practices throughout all those sites of care.
A lot of the work that ISMP conducted, especially in its early years, it did without much recognition. It was a hidden jewel. Therefore, there may still be a lot of people in healthcare who don't understand how grateful we ought to be to ISMP, how much we owe them. And so to that organization, I just say thank you. You were there from the start.